Namaste and welcome to the next episode of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing Rudro and we have seen how we can diagnose infarct, the basic principle to relieve the infarct and how we can choose the drug and its kalpana to treat the infarct patients. I have asked you one question that I have seen the Vaidyas using Arjun abundantly in the case of infarct just because in the text it is mentioned as a Rudya Dravya. Let us discuss this point because it is a very important point as far as clinical practice is concerned. Now Arjun is described as Rudya, no doubt about it. We use it in the form of Churna, Vati or Arjarishta in many forms. Now let us discuss if a patient is in front of you, it is having infarct, maybe one or multiple infarct condition, and you have Arjun Dravya in your clinic. Let us discuss really Arjun is indicated in the patients of infarct. Now I am putting in front of you my opinion. If it is wrong, please give your suggestions. I am open to hear them. Let us see Arjun now. First, Arjun Twak is used. It is Rudya Karma mentioned in the text. What are the Rasya? It is Kashaya Ras mainly, which is very very strong Kashaya Ras, Katu Vipa, Shita Virya and Laghu Ruksha Guna. What are the other uses of Arjun which we really see in the clinical practice? The main is it is Ratta Stambha, and which participation of which Rasya everything. Kashaya Ras is strong, so it is Akuncha, ascendant in power. So if blood vessel is bleeding, it will close the open ends of that blood vessels by Kashaya Ras. Stambhane Shitaha, so it will add to this Atta Stambhan action. Shoshe Rukshaha, so if there is any increase in the blood volume like Ratta Pitta, it will reduce the blood volume also. So Kashaya, Shita, Ruksha, all these properties of Arjun are in action whenever there is bleeding from body, whether it is external bleeding or as well as internal bleeding. Kashaya Ras is so dominant that Arjun is used in the case of fractures or Asthibhagna to heal the fractures because the Kashaya Ras helps in the healing of Asthi. So, two main actions of Arjun which we use in practice is Ratta Stambhan and as well as Asthi Sandhanakara. Arjun is so Kashaya Ras and Ruksha Guna that to reduce that Rukshata or Kashaya Ras intensity, Arjuna Kshirapad is advised or Arjun Ghruta is also advised. Means these properties of Ruksha Guna, Kashaya Ras are so dominant in the case of Arjun. Hope you understand this. Now let us move towards the patient of the infarct. What has happened in the body of the patient in the heart? The blood vessel is already blocked and the blood vessel's nature is Sukshma. Now Arjun is Rudya. You are using Arjun in the patient of the infarct just because it is Rudya. What will happen? When there is Ratta Pitta or bleeding, we are praising Kashaya Rasa, Ruksha Guna, and it is going to ascendant property and will close the mouth of the blood vessels and the there will be stopping of the blood flow. Shita Guna will also do. Here there is already blood vessel is choked up. there is already stoppage of the blood supply in the blood vessel because of that obstruction. And if we use Arjun in such patients, what will happen? Astringent property of the Arjun will act definitely, and because of that astringent property, it will further close the blood vessel. It will further close the blood vessel. You are already using Arjun in the patient where blood vessel is already obstructed, and you are increasing the obstruction by the Kashaya Rasa. The blood flow is already obstructed because of the Sotorose, and you are adding Shita Virya of Arjuna in that heart vessel, Stambhani Shita. So you are affecting the blood supply again by adding this Shita Virya of Arjuna. So what will Arjun do when there is infarct? It will close because of these all properties. It will further reduce the lumen of the blood vessel which is already obstructed, which is already small in nature. Hence, in my opinion, Arjun, though it is Rudya, it is totally contraindicated in the case of infarct or in any case where there is diminished blood supply to the heart or any other part of the body, though it is Rudya. Hence, Arjun, in my opinion, should not be used whenever there is stoppage of blood supply or reduced blood supply, though it is Rudya in nature. Hope you understand that. If there is any suggestions, I am open to all of you, and if you logically prove that Arjun will act in the infarct by this way or this Rasavipa Gunam, I will accept it by broad mind. But Kashaya Ras, Shita Virya, Ruksha Gunam, all will increase this infarct, and you are increasing the samprapti in such patients. Then when actually Arjun is indicated as a Rudya Dravya, we will discuss in the further course of the time. See, last episode I told you Arishta Kalpana is good for the infarct. Though you are going to use Arjuna Arishta, it will have Yavayi Vikasi Guna, Sukshma Guna, but main properties of Arjun will remain as it is. No, they will reach faster to that infarct side. Only thing will happen, but again the action will be the same of Kashaya Rasa. So Arjun in any form is totally contraindicated because this logic of Rasa Viryapak of Arjun. Hope you understand that. We will discuss this Rudra further in the next weeks also. Just one request to all of you. I am on the travel for few days from tomorrow, so I will try my best to upload the episodes on the Friday evening, depending on the circumstances around me about Wi-Fi, etc. There may be a late or maybe a gap of 1 or 2 weeks also. I will try not to have any gap, and just the chain of the lectures I will try to maintain it on every Friday evening. Thank you very much.